Hello, good evening. My name is Nancha Rebecca, a BNT, yes, 2.3. So I'm here. I'm sorry, I'm doing it from my home. Yes, I'm doing resuscitation of a neonate. So briefly, resuscitation of a neonate is always done to babies who have no breath. That is called asphyxia. So these babies, the breath is always usually below 100, and we know that the normal breath for neonate is between 100 to 160. So when these babies, when they are below, we try resuscitation, or we do, yes, resuscitation. And we know that when a baby is sleeping or is calm, these what the heart rates may go below, they may go below 100. So you may find that when the baby is sleeping, they may be 70 to 100. So mother should not be should not be worried. And when a baby cries, means the body is very active, and this the heart rates may go beyond even 190 because the baby is crying. So for us, we are focusing on a baby that is having asphyxia. We are trying to do resuscitation. So first of all, this is an emergency. But before I go there, I will be explaining it in an hospital setting and in case I'm home. So when I'm in a hospital, I will set requirements, or I will set a resuscitation tray, whereby the tray always has a stethoscope. Stethoscope is the one that we use to listen to the heartbeats. Yes, we press it on the baby's left side of the chest to hear the heartbeats. Then we always have an arm bag. Hey, now this is what I've got as my arm bag. The masks, I don't have a mask. I will use this as a mask, my wrist. Yes. So these two, the arm bag and the mask, we press them on the baby's arm so that we can give a breath. Yes. So we also have a sucker. These tubes that are used to suck in the nose and in the mouth to remove secretions. So we always have clean water, gauze to clean water to clean that sucker, the gauze to clean the baby's secretions. Yes, briefly, that is what we have in the hospital. And we have a tray of drugs. Yes, those drugs may have like fluids, normal saline, and we may also have like adrenaline. Yes. So now when we are at home, we always improvise. We don't have all those things. So now I'm going to explain the hospital way and a bit of improvising when I'm home. So to start with, this is an emergency. You have to call for help. Whether you're home or you're at the hospital, you have to call for people to come and help you. If in the hospital, you're calling an emergency team to come and help you. If you're at home, you're calling anyone around to help you, maybe bring a van or a car to help you carry this baby to the hospital. So after calling for emergency, I have to make sure my hands are clean. If I'm home, I'll go to the sink to clean my hands, or use a sanitizer if I'm in the hospital, and wear gloves. Yes, even on our tray we'll have gloves there. I forgot to mention them. So I have to make sure my hands are clean, not to introduce infections to the baby. Yes, and also put on a mask sometimes. Yes, if I'm going to use these equipments for the hospital, I have to put on a mask to avoid breathing through the baby's face. Yes, a mask must be there. So then I position the baby. So when I'm positioning the baby, let me put my arm back here. When I'm positioning the baby must be flat and facing me. So we assume this is the head of the baby and that is the baby there. So, and I make sure the baby is warm. I have to make sure the legs are crossed, the hands and the head, to avoid hypothermia. Yes, the baby may get a lot of coldness, and that is another problem. So when I make the baby is warm and whatever is flat, I try to massage the back. I turn the baby and try to massage the back so as to stimulate breathing. After that, I'll start with us. All those are done very fast. So now I have to assess for breathing. If I'm in the hospital, I'll get my stethoscope, put on a baby's chest to listen. Are there heartbeats? I will look at the chest movement. Is there anything? No. If I'm home, I'll get my nose, my ear, try to bring it closer to the baby's nose to hear. Is there anything like breathing? And also observe the chest. Is the chest going up and down for the baby? Then after seeing that there is nothing, then I'll have to make sure that I start suction. Yes, so maybe the baby has secretion, so I'll get my sucker, the other tube, make sure it's a bit wet, put it in the normal saline on the clean water, and then go to suck in the nose as I remove, clean, even in the mouth of the baby. So I make sure they are both clear, the nose and the mouth is clear. Then I get my gauze to clean, meaning if I'm home, I don't have a sack, I'll just get a piece of cloth, clean cloth, if it's an handkerchief, and I try to clean the baby, the nose to clean and the mouth, to see that the airway is open, the nose is not blocked, and the mouth is not blocked. So after that, I will again assess the chest to see, has this helped out? Were they the suctions, the secretions that are blocking the airway? I'll observe with my eyes, how is the chest? Is it moving up or down? Meaning if it is moving up and down, their breath. If it is just flat, there is nothing. Then get my stethoscope and listen to the heartbeats. If there is nothing, meaning baby needs help more. So now I'll introduce a resuscitation breath. This is where I get in my arm bag and the mask. I press them on the mouth. But when I'm pressing this mask, I have to get a size for the baby that fits the baby's nose and mouth, not a big one. You find some people are using adult masks. That is not advisable. So I make sure this mask is fitting all of the mouth and the nose of the baby tightly without air escaping. And then I put on my arm bag. In fact, before I put it, they must be connected together. Then I come and press it, make sure that it is tight, no air is escaping. So I put the first breath, and when I squeeze the air in, this chest must go up, because when the chest goes up, it shows that air has gone in. So I do it, the chest goes up, I release. Then I do another compression, second one, very deep. I see the chest moving up. Then I release. So because when I release, the air is going out. Then I have to observe the baby. After those two rescue breath, I have to access the chest again. Look at it as the breath started coming up and down. Is the chest moving up and down? If it's not there, I'm not seeing anything, I'll get my stethoscope and listen again. Is it there? If it's not there, it means the baby still has no breath. Then I'll go to chest compression. But before that, when I'm home, I don't have the arm bag and the mask, meaning I'll use my mouth. I'll improvise. I have to get the baby's nose and mouth. I cross them tightly with my mouth. So I put them inside, I close them, and I breathe for a second, like I power in air in the baby, through the baby's nose and mouth. So I'll breathe out. And when I do that, remember also my mouth must be tight on the baby's nose and mouth. So when I press for a second, that air, I breathe out that air, I will see the chest of the baby coming up. I'll give it another second for the air to go off. Then I'll breathe out again, tightly on the baby's nose and mouth. I'll see the chest coming up and I release slowly. So this is the same as the other way of using an arm bag and a mask in the hospital. So I'll also assess and observe, is the chest moving up and down? If it's not there, it means the baby still needs more assistance. So now I'll go to the chest compression. So chest compression, when I'm doing it, I'll consider the middle part of the baby between the nipples. This is the nipple. Just open a little, don't have to expose the baby. So I have to see the nipple, one nipple here, another nipple here. Then I put my 2 fingers. I'll put them in between those 2 nipples and I press downwards. Remember, this baby is soft. You don't have to press so much. You may break the limbs of the baby. So when I press downwards, it's like an inch and a half down. I press down. When I press, then I start counting now. I'll make 30 of them. So I'll be doing 1, 2. I press as I come up. 3, 4. I count up to when I get 30. 4, 5, 6, 7. I'll continue up to when I make 30. When 30 of them are done, I'll get my arm bag and mask again to support immediately. I put on the nose and the mouth. I compress to support air. So immediately I finish the other one of compression, I'll put this, 2 of them, 1, 2. After that, then that will be a complete set of chest compression and rescue breath. Then I will assess the chest. Get my stethoscope, listen again. Is there anything? If not, I will see the chest movement. Is it moving up and down? If not there, I again do the chest compression. I count 30 of them, 1, 2, 3, 4, 5, up to 30, and I repeat this of the arm bag. So like we said, if I'm not in a hospital, I'll do the 30 chest compression. Then after that, immediately I'll put my mouth, cross the nose and the mouth of the baby, and breathe in, breathe out. Try to push in air in the baby's chest. I do twice of them. I put the first one, I put a second one. So that will be a complete round. I assess the baby's chest to see as the breath comes. So I'll do like 5, I can do like 5 rounds of these 3 rounds or 5 rounds. Yes, because remember, when you overcompress the baby may get tired, the limbs and that kind of thing. So I'll do 5 rounds of those, 30 compressions, 2 breath. 30 compressions, 2 breath, I assess the baby. 30 compressions, 2 breath as I assess the baby. If all the 5 compressions are done, by the time they are done, we assume the team will be around. We'll have arrived. The team that will assist you to take the baby to the hospital, or the emergency team will have arrived to see what next. But in some cases, when you see that the baby has no breath, that's when we bring in the drugs. Then we'll be observing at what rate have we reached of the heart rate. So if the heart rate now is between 50 to 70, means this baby needs drugs. So the drugs that are mainly used is adrenaline. Yes, it's called epinephrine. Yes. So mainly we give it Boras through the umbilical cord vein. Yes, umbilical cord vein. So it's why we give it Boras. They always give 0.1 to 0.3 milligrams. Yes, so this adrenaline will assist to expand the lungs to see that the heart rate can improve the heart rates. Yes. So another thing that we can give, like if we see that this baby has signs of shock or has lost blood, we can give fluids, mainly like normal saline. We give it also Boras, 0.9%. We give it Boras, yes, to assist with signs of shock, Yes. So briefly, that is it. That is how the baby is managed. And with all those done, if the baby is to have a life, the baby will come, you monitor the respiration, the heart rate, and you find the heart rate is back to normal. It's between 100 to 160. It will come back slowly. But if the baby will be completely dead, no life, it means that even if we give the drugs, the heart rates will remain below 50 and they will go till we don't have anything. Yes, briefly, that is what I could do. Thank you so much. I think I will see collections. Yes, we have gone wrong. Thank you so much.